everyone, welcome back to How to College. This is Katie. And I'm here with Dr. Mary Tobin, who is the chair of our nursing division here at Wesleyan, and we're going to talk a little bit about nursing. You know, we've talked about how to pick a college, choosing a major, and one major that I know has become very popular and is very needed is our nursing major. So she's going to talk a little bit about maybe going into high school, thinking about what you want to do with nursing, how you start looking at programs, what you need to start figuring out with all of those pieces. So you want to talk a little bit about that?
Yeah, well, I'm just happy to be here. Thanks for having me.
Yeah, no problem.
You are right. Nursing is getting very popular, and I'm so excited about that. I think the pandemic saw a lot of healthcare heroes, and so, you know, we have 30 freshmen now coming in, so we're really excited and growing. And that gets into one of the questions I wanted to make sure people know is the college you're looking at, does it have a wait list?
Oh.
And that can be something you want to ask when you look at various colleges, because it's getting so popular. And colleges only have so much clinical access, and we're the guests in those clinicals.
Right.
And so they tell us how many we can have, and that's something that I think is good to ask about.
Definitely. So let's say you're a junior and senior and you're wanting to make sure you can get into those programs, not get put on the wait list. What are some things that you recommend, either classes to take or things to really pay attention to as you're doing your applications?
That's a great question, Katie. A lot of high schools have wonderful classes that you can take if you're thinking you want to be a nurse. And one that I love is the CNA.
Yes.
A lot of high schools will have that. And I say pick that up. If you get a CNA, you can work at local nursing homes, in some hospitals. So that's a class to pick up in high school.
So thinking about nursing and thinking kind of about where it's going, is there anything else that you think would be good for students to know as they're choosing that as a major?
Yeah. You know, one of the things I want students to know is schools are guests of hospital, and we are obliged to follow what the hospitals dictate regarding what students need to get in there. And so, you know, there's things like, you know, we do a background check. And so certainly if there's something on their background, I would have to send that to the Iowa Department of Health to see whether they would allow clinical. And there are certain vaccines, you know, certain places around the nation need the students to have the COVID vaccine. So, and those things can change.
Right.
Because we're
any
guests
minute.
at the hospitals.
Yeah.
And so, you know, so any minute. So we just have to be prepared. So when prospective students come in, and all my freshmen know what we currently need for hospitals, but those can change. But we have fantastic clinical sites here. It's something I wanted to come out in this.
Yeah.
We are so fortunate here in southeastern Iowa. The hospital that is just down the street at Burlington provides amazing patient experiences. We have a wonderful small hospital right here in Mount Pleasant. And they love our Iowa Wesleyan nursing students, and they're ready to hire them the minute they graduate.
Good. That's an important thing. When you're looking at nursing programs, you want to make sure that it's going to make you marketable and get out there and get a job. That's what we want the students to do, right? Get out there and start practicing in that. So
can I say one more thing?
Definitely, go ahead.
You know, one of the things that I think is a hallmark of our program is the fact that in every nursing class, we pay attention to how you would help patients with mental health issues. Because as you know, mental health is now an issue across the country. And so now in every class, I tell my students, you know, you're going to encounter patients with mental health issues on every unit, not just on a mental health unit. And so our students really have a lot of theory. I think that makes them very, very effective in their job. So.
Good. Awesome. Well, is there anything else you'd like to share about the Iowa Wesleyan nursing program in particular?
I'm proud of it. You know, our faculty, one of our med-surg nurses, she still has a hand in practice at Burlington, and I think she's one of the smartest nurses I know. She just really is there. She knows contemporary practice. Our instructors do have a hand in practice, and so they give you contemporary stories of what to expect when you graduate. And so I just think this is just the best nursing program in the nation. Thanks for having me.
Yeah. Well, thanks for joining us. And as always, stay tuned for more pieces of the college process. And thank you for joining us today.
It was fun. Thank you, Katie.
Bye.